Hello everyone. I'm sorry I can't be there with you today, but I thought I would try and use modern technology to connect with everybody and finish my presentation. You might see me looking up a little. I have some notes and actually the slides that we have in our presentation around me, and I have some other resources that I'll be using. So please don't, it'll be just like I'm in class looking at a bunch of other things. I wanted to start first by showing the resources that I used or that I regularly use in practice with families that are struggling with adoption-related issues. I know our presentation is specific to openness, so I will touch a little bit on some of the things that I believe that are pertinent to this case. And yes, so first, I use this book a lot, and it's in our resources at the end, but it's Nurturing Adoptions. Deborah Gray, I really like her. I've met her. She's a great presenter. If you ever get the chance to hear her, I think that she is amazing at doing therapy with kids. I also use this book, The Connected Child. I like this one a lot. I used it a lot when I was doing work in foster care in Seattle. And the other Deborah Gray book that I have that I use, this is the one that's specifically written for parents, Attaching an Adoption. And there's information in here that relates to adoption professionals, but the book that's more specific to adoption professionals is Nurturing Adoptions, with a smaller parent component in that one. And lastly, my practice specifically with children is doing play therapy, and I do experiential play therapy, which is a non-directive method of play therapy, and I use this book. It's Byron and Carolyn Norton, Reaching Children Through Play Therapy. I think I said this in class a few times, but play therapy, this specific type, is somewhat controversial just because there's a lot of figuring out the clients, what they're doing in the room. You're kind of dissecting it yourself. It's kind of open to interpretation. So I've heard from colleagues that I work with that use experiential therapy that it is somewhat controversial. But as I've been doing experiential play therapy, I actually think it's probably, of all of the play therapies that I've been learning about over the past year doing my play therapy certificate, I think this is the one that I find most effective, just because children are so directed, and especially kids that are struggling with adoption issues. They are so told what to do and told where to go, and they don't have a lot of power and control, and this therapy really allows them to communicate with us in their language, which is play, and tell us what they're experiencing, what they're going through out in the world. So whatever they're playing out in my playroom is what they're going through. And I would anticipate that Parker specifically might be playing out a distance between two caregivers. One of my kids that I work with who has adoption-related issues, she was adopted from the foster care system and had a really turbulent beginning to her life. For the first 8 months, she was taken into a drug house at one point, and then she was put in care with her paternal mother or paternal grandmother. And she, when we were doing therapy, had really not a clear idea of what adoption was. And when she played out her issues with her adoption, she would put 2 different kitchens in the house. So it was representative of the 2 mothers that she has in her life, her adoptive mother and her biological mother. And so I could see Parker doing something similar, except that maybe Parker would put a kitchen outside of the house and another kitchen inside the house, representing that one mother or one nurturing aspect of his life is not present, and that the other is inside the home, which home represents security and safety. So if the house is on fire, never a good thing. So that's kind of how experiential play therapy is, and that's one of the treatment and intervention strategies that I listed. Another one that we learned about in class that I really like, and I haven't had the opportunity to use it, but I would, is the write and release a letter. I just think it could be really cathartic for a child that, especially like Parker, he can't see his family and he really desires to know who they are. And so for him to be able to write a letter and either keep it if he really wants to, or, give it to his parents to, mail to the last known address of his birth mother, or give to the adoption agency, or, that paper that you write on and then light it on fire and let it disappear. Maybe he could write some words on those pieces of paper and kind of expunge it from himself so that he can feel better about having some sense of closure around that if his family isn't intending to continue to be involved in his life. Yes, and I think that he might really benefit from coming in and doing some of those therapeutic interventions on a regular basis. Like one of the kids that I've been working with, similar to Parker, doesn't know his family. He was adopted internationally, and we talked about that at different parts in his life, he might be triggered by something and need to come back and deal with it in another developmental stage to integrate that adoption issue into each developmental stage. So they'll plan on coming back, and that would be the same advice that I would have for Parker's parents, Mark and Amy, so that they could continue to support him throughout his lifetime with that issue. Bennett seems to have the ability to connect with his birth family, although maybe it would be a good thing long term, and maybe certain issues would come up that would change the ability to connect and have openness. Maybe the biological parents move, maybe the adoptive family moves, and there would be a need to change some things and have him have closure. And as long as the adoptive parents are really supportive and are not fearful of engaging in therapy, then I believe that kids can somehow manage to work through that struggle of not knowing their birth family. But if their parents are maybe engaged initially, it could be really helpful to get as much information as the adoptive family may believe that Bennett would need, and maybe the adoptive parents could remain in contact with the biological family and not necessarily have visits with Bennett, or vice versa with Parker. If there's a way to get in touch with them and just say, we just want to know where you are so that we can ask questions if things come up. So that could be helpful. Another treatment and intervention strategy that I identified was filial therapy. And I think that it could be really helpful. I mean, we've talked about in adoption work that having the adoptive parents engaged in the therapy process is very important because it continues to help with attachment. And filial therapy actually really does, it's the same type of work, and you're really empowering the child. It's similar, there's a lot of similar wording in experiential therapy as to other play therapy methods. So I'd be teaching them that language, and then they'd be doing brief play sessions at home. So again, filial therapy would be great because the parents are engaged and involved. And initially I'd be working with the parents and I'd teach them how to do the therapy, and then I would be out of the room with a bug in their ear and telling them what words and what language to use so that they could get comfortable with the therapy so they could do it at home and feel confident. The last type of therapy that I identified was also, I believe, from our reading. I have the book. It's Attachment Focused Therapy by Dan Hughes, and I didn't bring it with me today to my office, so I looked up on his website some information that I thought would be helpful. So these are characteristics that Dan Hughes believes that are important and essential to this specific type of therapy, and working on attachment. So eye contact, voice, tone, and touch. So allowing the child to engage in like nurturing, holding, like cradling them. So if they're an older child and they need to regress kind of temporarily to get a need met, this is similar to what I would do in experiential if they wanted to suck on a bottle, that they maybe didn't get that opportunity to do that with the adoptive parent, that the adoptive parent would hold them and let them suck on the bottle and, sing and make cooing noises, just do the same type of things that you would do as you were an infant because you didn't get that need met when you were little. So there's lots of opportunities for play, laughter, unconditional love and acceptance. So the goal is to have the child succeed and not fail. So there would be less discipline and punishment, and the decisions made in the therapy would be for the purpose of providing success. And those become the basis for the development of age-appropriate skills. So through the therapy, you're actually teaching them skills that they may be lacking. For, like, I'm thinking of, good communication, good eye contact, asking for what you need, things like that. And so the symptoms or problems are accepted and contained. The child is shown how these simply reflect their history. They are often associated with shame and must be reduced by the adult's response to behavior. So the adult responding in an angry or upset way maybe changes into an empathetic way. Instead of being angry and lashing out at the child and putting them in a timeout, they're able to empathize with the child and talk with them about why they're feeling that way and what's triggering them in the moment. The child's resistant to parenting and treatment interventions is responded with acceptance, curiosity, and empathy. So really teaching the parents to respond in a different way than being angry and matter-of-fact and cold. You're really wanting them to learn how to connect with their child. Celebrating baby steps is another aspect of Dan Hughes therapy. Anything small you reward by praise or by, finding the child's currency, and such as like time spent with them or a gift. I'm talking about the 5 love languages as I'm doing this, but I'm just thinking that those are ways to kind of gauge what is really important to your child. And I believe there's actually a test you could take about the 5 love languages so you could understand what your child's best way of receiving love is. And that's maybe how you could respond by praising them. Okay. So, this is a good one. The adult's emotional self-regulation abilities must serve as a model for the child. So, if a parent becomes agitated in a situation that they, in their own personal life and the child's around, like, I'm just thinking of my own life. But my husband and I, when we get in an argument, if we're talking calmly and trying to work through things, and then we resolve it and we give each other a hug and a kiss, my daughter's seeing how to appropriately resolve an issue. I'm just thinking for a child, especially that was in an abuse or neglect situation, or Parker and Bennett don't appear to have that type of a history, but because there's been a loss, maybe if they were seeing a loss responded to in an inappropriate way, using, I don't know, I'm just thinking like if they use drugs and alcohol, if Mark and Amy went out and were drinking or on a binge or never home, if there was a loss in the family or something, maybe they would learn to inappropriately deal with loss, and they wouldn't see healthy methods modeled for them. This is a good one for kind of openness. The child needs to be able to make sense of his or her history and current functioning. The understood reasons are not excuses, but rather they are realities necessary to understand the developing self and current struggles. So I feel like this is also pertinent to understanding, not keeping the child in the dark, and talking to them openly about their history and why their parents aren't there, you know, in an age appropriate way, but not sugarcoating that, you know, their parents are coming back tomorrow or they'll someday see their parents. But really, excuse me, my work phone is ringing and I'm sorry, it's gonna ring. And I'm sorry. And so the adults must constantly strive to have empathy for the child and to never forget that given their history, they're doing the best they can. So they have a trauma history. This specific case does not, but a lot of times kids who are working on attachment related issues are having they are having problems with that history that they have. But these two, they have suffered a loss no matter what. Their biological parents have made an adoption plan for them, and so they are not able to see those people on a day-to-day basis. Although there are healthy ways that they could stay connected with them, or just plain out grieve the loss of their biological parents, and that they, you know, won't have a Parker might not have a long-standing relationship. So how do you appropriately acknowledge his feelings and help him to move forward? There's more, but I'm going to move on to training and interventions because I know I'm at 16 minutes and 30 seconds. So a couple other things that I've written down that on the next slide it talks about training and interventions. So involve the parents in the therapy process, possibly individual therapy for parents if needed. So if parents are struggling with the connection that the child might have with their biological family, I mean, maybe Mark and Amy are struggling because Parker really wants to know who his biological parents are and have more connection with them, and he can't, and that's really setting them off. Deborah Gray actually does talk about different, in this book, talks about different attachments using the adult attachment inventory. And so secure, autonomous parents wouldn't struggle with that issue. In my thought process, they would be understanding of why the child was needing to connect with their biological family. But so I don't know that secure parents would have that issue. Maybe dismissing parents, preoccupied parents, disorganized or unresolved parents. I think the latter, the disorganized, unresolved parents, are probably going to have a really tough time just because they have an unresolved trauma history themselves, and so there might be struggles of their own with attachment. There might be struggles with a trauma that occurred, and they can't. And maybe they, you know, wanted to have a child so they could resolve those issues. There's lots of reasons people have children. We've talked about that in class. And so that's kind of my thought process on parents struggling with the ability to be open with the biological family. Parent education on the language to use with the child. So talking about how to deal with, you know, kids in different age groups and what to say, instructing the parents on that. In the Connected Child that I use, I talk about reducing fear and allowing for attachment by predictability, speaking simply and repeat what you're saying, honoring the child's emotions, giving choices, being an effective leader yourself, so leading by example, like kind of like I was talking about, showing them how to handle different situations in a healthy way, respecting the child's life story, preventing sensory overload, because obviously kids, especially, like I know I worked with a lot of kids who were drug affected, sensory issues were always so crazy with those kids, and so preventing sensory issues and overwhelming them is always important. Being approachable, so not being angry all the time and not being sad all the time, but being even keeled so that your child knows that they can come to you and talk to you. And introducing children to a new environment. So if they're going to a new school, if they're meeting new people, trying to do that first before you send them off on the first day, because they might be struggling more with new people and all that. And the last thing, and all my parents that I work with, I talk about patience, that therapy is not going to solve it overnight. It could take years for them to resolve certain issues, and it could be that it resolves and then it comes back. So, but really aligning with the parent, that's my work, aligning with the parent and helping them to know that no matter what, if the child comes back and has problems, that I'm going to help them with those issues. I'm 20 minutes, I'm sorry. Developmental integration of adoption through the lifespan. I've talked a little bit about that. Flexibility is really important, and that each child's different in this specific case. Obviously, that's the way it is. Each child has a different relationship with their biological family, and so, talking to them about the fact that they have different parents and we're all different and we all make different choices, but that they love you, and because they do. Obviously, they made a very loving decision to, put him in this family. Although some people would disagree with that, I think it's, they could have made other choices, and so, not that you have to explain that to the child, but, and then, let's see, creating a life book, and obviously that could be helpful, so the child can know their adoptive or their biological family, and support with other adoptive families. So that will be really important in keeping the family feeling good. Like I was talking about those attachment, preoccupied parents, disorganized parents, dismissing parents, those parents might really, really struggle, and they might really need to hear what other people's experiences were. And the last one, support education, mediation with navigating open adoption relationships, and talking with birth parents. Oh yeah, I think obviously education and support to to both sides, adoptive and birth parents, are going to be really important. If I were to be working with birth parents who had made an adoption plan, I do actually have a family that I work with that weren't planning on making an adoption plan, and now they're struggling with not having made the adoption plan, and the mother specifically is kind of struggling in attachment issues with the little boy, because she was planning on the adoption, and then her plan changed when the dad didn't want to make that plan. So kind of working on both sides, being able to be neutral and understand both parties. I think that's hard, especially if you're working. Like I know for a long time, I really related to the adoptive family because I was working foster care. I worked with all the foster families. But then I went to Bethany and I worked briefly as a pregnancy counselor. And so my role completely switched, and I was supporting the woman and the birth parents, the father and the mother, and even the extended family. So I think being able to be neutral and understand that both sides, it's a really tough decision. Whatever you were choosing for openness, it would be difficult. So trying to be empathetic and understanding to those parents. I have just jabbered away, and I'm sorry if I went over too much, but I wanted to get all my information in, and I hope that you guys have a great remainder of the class, and sorry I couldn't be there with you today, but I will hopefully see some of you in case consultations. So thank you. Bye.